All right, inferior limb palpation, scanning the room, the clock. Okay. So we'll start with the bony landmarks first, the iliac crest. I'm gonna have my client bring his arms out, and I'm gonna come in on his sides to find that iliac crest right here. Next would be the lateral condyle of the femur. You wanna come face that way, face the camera. Okay, we're gonna find the patella. We're gonna laterally come off of that patella onto that joint line, and we're gonna move directly superior to find that lateral epicondyle there. The next is the calcaneus. So we turn around. Can you bend your knee at 90 and balance yourself? Okay, we're gonna come from that Achilles tendon and move inferiorly to meet the calcaneus here, which comes to about that mid-tarsal bone ridge right about there. So again, the calcaneus here. The next is the tibial tuberosity, so you can go ahead and turn around again. So again, we're gonna find that patella or the knee. You wanna bend your knee aside, lift your foot. There you go, and move directly inferior to that bony prominence here, which is that tibial tuberosity. And on the head of the fibula, again, we're going to start at that patella. We're gonna move laterally on that joint ridge or the joint line, and then move directly inferiorly to the head of the fibula. Okay? Muscles, the vastus lateralis. So stand facing the whiteboard. The vastus lateralis is a quad muscle, so it is going to, we know it's going to insert at the tibial tuberosity and then extend the knee. So it's going to originate at the lateral lip of the linea aspera. So we're going to grip the thigh, kind of where my fingers touch, and move up. We know we're on the linea aspera, and then if we move just laterally, we're on that lateral lip of the linea aspera. We also have the greater trochanter, so face me. So we're gonna move up the hip to find that bony prominence here, and I'm gonna have my client rotate his hip. And if my fingers are moving, which they are, I know I'm on the greater trochanter. And then the other point that it originates is the ischial tuberosity. No, the gluteal tuberosity. The gluteal tuberosity. So to find the gluteal tuberosity, I'm going to find that gluteal fold, and then I'm going to press directly into there. I'm going to have you lift into hip flexion a sec. Okay, come back down. So about right there, I feel that gluteal tuberosity. So again, action here is knee extension, which I'll show you, is coming from flexion into extension. Okay, semitendinosus, hamstring muscle. So it's going to be on the posterior side, and we know it's going to originate at the ischial tuberosity. So let's find that ischial tuberosity. So again, we're going to find that glute fold here. I'm going to have my client bend his, or flex his hip and bend his knee. There. I'm going to press up into that ischial tuberosity. So why don't you straighten your leg and then bend it back up. Straighten it down. And then bring it back up. There we go. And that ischial tuberosity is moving under my fingertips. And then it's going to insert at the pes anserine. So come and face the camera. So the pes anserine is going to come it's going to be on the anterior, posterior, and medial aspect of the tibia, which is about right here. And that is where that semitendinosus is going to insert. And we have 5 actions here, which I'll show, so scooch back. So since it's on the posterior, we have hip extension. We also have knee flexion. Then we're gonna have medial rotation of the hip, medial rotation of that flexed knee, and then also posterior pelvic tilt. All right, the soleus is on the posterior calf, so scooch back a little bit. So we are gonna be originating on the posterior and proximal aspect of the tibia, which is here, and then the posterior aspect of the head of the fibula, which we'll find that again, coming off that joint line and moving inferiorly right here. And then it's going to flow down to insert at that calcaneus and out the side, right here. So again, just one action here of plantar flex, which is dropping your toes towards the floor. All right, the gluteus minimus. So the glutes posterior again, face the whiteboard. Good, so bring your arm out straight ahead. So we're gonna find the iliac crest again. So kind of come this way, just make sure I'm on it, good. If you wanna rotate towards your left, thank you. And then I'm going to track towards the ASIS here, and then back along it to that PSIS. Which is here, turn. Good. So again, it's going to originate between those anterior and inferior gluteal lines to then insert over to the anterior aspect of the greater trochanter. So again, we'll find that greater trochanter. I'm moving up that thigh to that bony prominence. I'll have my client rotate again. Good. I feel it under my fingers, so I know I'm on the right spot. So it's going to flow again from those gluteal lines, flowing laterally and distally to meet at that greater trochanter. The gluteus minimus actions would be abduction here, medial rotation, should probably face this way, and then flexion of the hip. The last one is the TFL, or the tensor fasciae latae, which sits just superiorly to that gluteus minimus, having the same actions. So we will turn. All right. So the TFL is going to, I'm totally blanking right now. So, oh yes, it's going to originate at the iliac crest, so just posterior to the ASIS. So again, arms out, we'll find that iliac crest. We'll move towards that ASIS. And then just posterior to that, it's about 2 to 3 finger widths apart. And then it's going to insert at the iliotibial tract, or the IT band. So, but it's just kind of the length of that iliac crest down to the greater trochanter, which then turns into the IT band. So the IT band runs that lateral aspect of the thigh superior to the lateral, or the vastus lateralis. And the actions here of the TFL are the same as the glute minimus, which would be abduction, medial rotation, and hip flexion. And that is it.